Good day everyone. My name is Baishaleha Husna Pinto from Group 10 and our group topic is all about substance and addictive disorders. For my assigned topic, I'll be discussing the treatment of substance-related disorders. This includes biological treatments, psychosocial treatments, and prevention programs. Second is gambling disorder. Third is impulse control disorders. It includes intermittent explosive disorder, kleptomania, and pyromania. So treatment of substance-related disorders refers to a set of medical, psychological, and social approaches designed to help individuals reduce or stop their dependence on drugs or alcohol. So basically, ito yung part wherein dinidiscuss kung paano natutulungan yung mga taong may addiction sa drugs or alcohol. So sabi sa book, wala talagang isang perfect treatment para sa lahat kasi iba-iba yung sitwasyon ng bawat tao. May mga instances na mas effective yung physical side pero meron ding mas hirap sa emotional or yung sa social side. That is why kaya sabi ng mga expert is the most effective way to treat addiction is multifaceted. Meaning, dapat sabay-sabay tinatarget yung biological, psychological, and social aspects ng tao. So, simulan muna natin sa biological treatments. Pag sinabing biological treatment, ito yung medical approaches or paggamit ng gamot para makatulong sa pag-manage ng addiction. Usually, ang goal dito is bawasan yung cravings, pigilan yung withdrawal symptoms, or i-remove yung pleasurable effects ng substance. There are three main types of biological treatments. First is agonist substitution, second, antagonist treatments, and aversive treatments. First is ang agonist substitution, using a safer drug that has similar effects to the addictive drug to reduce cravings and withdrawal. Dito is binibigyan ng pasyente ng mas safe na gamot and halos kapareho ng chemical makeup drug na ina-abuse nila dati. By that, hindi sila nabibigla sa mga gamot na binibigay sa kanila. Example na lang is yung methadone para sa mga dating heroin users. So since iniinom lang siya, hindi gaya ng injected heroin, mas mabagal siya mag-react sa katawan nung pasyente. Kaya hindi ganun kalakas yung high pero at the same time nakaka-help pa rin siya para hindi makaramdam ng matinding withdrawal. Next is antagonist treatments, using drug that blocks or cancel the effects of the addictive substance. This type of gamot naman is binablock niya or kinokontra niya yung effect ng drug sa katawan ng patient. Example is yung naltrexone na ginagamit para sa alcoholic or opiate users. So kapag iniinom nila to, hindi nila nararamdaman yung high or yung sarap ng substance. Ang challenge lang dito is kailangan willing talaga yung pasyente na inumin ito kasi syempre mawawala yung pleasurable effect ng drug. Last but not the least is yung aversive treatments, using a drug that causes unpleasant reaction when the addictive substance is taken to discourage use. Ito naman is yung type na gamot na ginagawang unpleasant yung experience kapag ginagamit ulit ang substance. Example is yung antabuse or disulfiram. Kapag umiinom ka ng alcohol, habang umiinom nito is nafe-feel mo yung pagsusuka, pagka-dizzy, and mabilis na tibok ng puso. So, nagkakaroon ka na ng negative association sa alcohol dahil sa naramdaman mong side effect nun. Kaya mas madali nang iwasan. So, next naman is psychosocial treatments. Focus on changing a person's behavior, thoughts, and social environment to help them overcome addiction or mental health problems. So, ang pinaka-main goal dito is ma-help yung mga patient na magbago yung lifestyle nila and matutong mag-handle ng stress and maiwasan yung mga relapse or yung pagbalik nila sa bisyo. Meron tayong 4 na psychosocial treatments. Una is ang inpatient or residential treatment programs. Dito is nakatira muna yung mga pasyente sa isang rehab center wherein natututukan sila 24/7 and binomonitor. Ito yung madalas para sa mga may severe addiction kasi kailangan nila ng constant support and discipline. Next is outpatient programs. Ito naman is hindi sila nakatira sa rehab center. Nakatira pa rin sila sa bahay nila but pumupunta lang sila sa counseling or therapy sessions. Mas flexible and mas mura ito pero syempre kailangan din ng disiplina and cooperation ng pasyente. Next is community support program. Ang maganda dito is may peer support kasi makakasama nila yung mga iba't ibang tao na dumaan din sa pareho nilang struggles and nag-open up sila and nag-share ng mga experiences to cope up. Ginagamitan din ito ng 12-step model na nagtuturo ng acceptance, surrender, and long-term commitment sa pagiging sober. Last is cognitive behavioral therapy or yung CBT. Ito yung pinaka-effective na therapy because dito tinuturuan yung mga pasyente na kilalanin yung mga triggers na kung ano yung nagtutulak sa kanila, bakit sila gumagamit ulit. Tulad ng stress, emotional pain, or peer pressure. And also paano nila maiiwasan or makokontrol yung sa mas healthy way na paraan. Now let's move on to the preventions. So ang prevention is refers to a program or strategy na aim na pigilan yung substance abuse bago pa to magsimula. Since mahirap and mas magastos talaga gamutin yung addiction, mas better siguro na iwasan na lang talaga siya, umpisa pa lang. So, paano ba maiiwasan to? First is educational campaign. Habang maaga pa, mas mainam na ma-aware sila kung ano yung mga risks and masamang effects ng drugs at alcohol para makaiwas na sila. Next is yung community-based prevention program. Nagtuturo sila ng healthy lifestyle and coping skills para hindi agad ma-impluwensyan ng peer pressure yung mga kabataan ngayon. Next is targeting at-risk groups. Usually, mga targeted dito is yung mga kabataan din or sa mga may risk groups para hindi sila ma-expose sa substances ng maaga. And of course, social resistance training. Dito tinuturuan sila how to say no sa mga nag-aalok sa kanila sa droga or alak so that hindi sila madaling ma-bad influence. Now let's move on to the gambling disorder. Is a condition where a person can't resist the urge to gamble even when it causes serious problems in their life like debt, stress, or relationship issues. So if nagtataka kayo bakit nasali ang gambling disorder even though hindi siya substance, it is actually placed under the same category as substance-related disorders. The reason why is pareho sila ng pattern behavior, may craving, may tolerance, and may withdrawal symptoms, just like in drug or alcohol addiction. In short, kahit may substance ang involved dito, yung behavior itself mismo, which is yung pagsusugal, is nagiging addictive na rin. People with gambling disorder are constantly preoccupied with gambling, meaning laging nasa isip nila yung sugal kahit anong gawin nila. They keep playing even if they already experience serious consequences like financial loss, relationship problems, or even illegal issues. Now, according to the DSM-5, there are diagnostic criteria for gambling disorder. Persistent and repeated gambling behavior that causes serious problem or distress, shown by having 4 or more symptoms within a 12 period of month. Meaning, if may 4 or more symptoms ka dito sa 9 criteria na to within 12-month period, maaaring gambling disorder na to. Please pause and take time to read. So if you've met 4 out of 9 of these symptoms, it is mild, moderate if 5 to 6 symptoms, and severe if 8 to 9 symptoms. So after understanding what gambling disorder looks like, let's now talk about why it happens or the possible causes behind it. Gambling disorder doesn't have just one cause. Usually, it's a combination of biological, psychological, and social factors that lead a person to develop the problem. First is ang biological causes. It can be dopamine imbalance, which is the brain's reward system releases too much dopamine when gambling, making the person feel excited and high. That's why they want to do again and again. It also can be genetics. Kung may kamag-anak na may addiction, kahit alcohol or drugs man yan, mas mataas pa rin yung chance na ma-develop din ang gambling problems. It can be brain function. Some people have weaker impulse control kaya mahirap pigilan yung urge nila na magsugal. Next is psychological causes. This includes stress or yung emotional problems. Ginagawa nila itong way para daw makalimot sila sa problema, depression, or anxiety kaya nagsusugal sila. It can be also personality traits. Yung mga impulsive, competitive, or mahilig sa thrill yun sila ang mas prone sa gambling disorder. It can be belief in luck din. May mga tao kasing naniniwala na sinasabi nila, malas lang ako ngayon kaya natalo ako. Next time bawi ako. And next is magsusugal na naman sila. If natalo na naman, ganun naman yung sasabihin nila. So naniniwala sila. Belief in luck. Third one is yung social and environmental causes. Exposure naman if sa environment mo is normal na yung sugal. Maski family or friends mo is nagsusugal. So madali ka na rin mai-impluwensyahan kasi yun yung kinalakihan mo. Accessibility, madaling access sa casinos, online games, lalo na ngayon marami nag-endorse ng mga betting sites na mga influencers and pinapakita nila or pinapost lang nila yung mga winning moments nila kaya natutukso yung mga gamblers. Last is yung peer pressure. Minsan hindi mo talaga gustong magsugal but since nape-pressure ka sumasabay ka lang sa barkada mo or gusto mo mapabilang sa grupo kaya ka nagsusugal. Now that we know the possible causes, the next question is paano nga ba ginagamot? Or let's move on to the treatment part. Treating gambling disorder can be quite challenging kasi madalas hindi agad inaamin yung gamblers na may problema sila. Usually, they only seek help when the situation has already become severe na. Like, nababankrupt na sila or broken na yung family nila. The treatment for gambling disorder is similar sa treatment ng substance dependence, like yung drugs or alcohol addiction. Mayroon ding Gamblers Anonymous na parang version din ng Alcoholic Anonymous, which is nagsasama-sama yung mga taong may problema sa alcohol and nagsishare sila ng experiences nila. And gumagamit din sila ng 12-step program para tulungan ng mga tao na tigilan yung sugal. However, 70 to 90% is nagda-drop out sa program na to kasi hindi nila gustong According kay Ashley and Buchik, noong 2012 na study nila, is 70 to 90% is nagda-drop out sa program na to kasi gustuhin dapat ng pasyente na talaga magbago para mas maging effective yung treatment. Next is yung Cognitive Behavioral Therapy or CBT. So may dalawa siyang version which is brief treatment and full course treatment. From the word itself, brief, so ibig sabihin maikling therapy session lang. And then yung full course treatment is mahaba and tuloy-tuloy na therapy. Brief and full course treatment have both been found to help and both are recommended by the experts. And dahil sa mataas na rate of this disorder and mataas na rate sa dropout treatment, maraming research na ngayon na nagsisimula to compare kung ano ba ang mas effective, yung full course treatment or brief treatment ba. In addition to gambling disorder, the DSM-5 also included the internet gaming disorder as a condition for further study. Because some people become too focused or hooked on online games to the point na nagde-develop na sila ng tolerance and withdrawal symptoms, like parang sa ibang addiction lang. So the goal of adding this condition is to encourage more research about its nature and possible treatments. Last of my assigned topic is yung impulse control disorders or conditions where a person cannot resist urges to act even if the behavior is wrong or harmful. They feel tension before doing it and relief or satisfaction afterward. So these are group of psychological disorders kung saan nahihirapan yung tao na pigilan yung biglang pagnanasa or impulse nila na gumawa ng isang bagay kahit alam nilang nakakasama sa sarili nila or sa iba. Usually, bago gawin yung act or bagay na yun is nakakaramdam muna sila ng matinding tension or excitement. And after sila mag-succeed sa ginawa nila is makakaramdam sila ng relief or pleasure. That's why kahit negative yung outcome, parang napupush pa rin silang ulitin yung behavior na yun kasi nga may temporary feeling sila of satisfaction afterward. Sa disorder na ito is meron silang common characteristics tulad ng impulsive, hindi nila makontrol yung emotion and hirap silang maghintay or mag-delay gratification. And according sa DSM-5-TR, may tatlong main types ng impulse control disorders, yung intermittent explosive disorder or yung IED, kleptomania, and yung pyromania. Dito sa IED is when a person suddenly gets extremely angry or violent over small things. They can control their temper and often regret it after their outburst. This condition wherein yung tao is may sudden and intense outburst of anger or aggression. So kadalasan hindi tugma yung situation nila sa kinakagalit nila. Pwede silang magmura, manira ng gamit, manakit ng tao dahil lang sa maliit na bagay. And then after ng outburst nila is madalas nakaka-feel sila ng pagsisisi, guilt or hiya. So for an instance, may kaibigan akong na-trigger ako sa sinabi niya and then nagalit ako like outburst, nagwala, nagmura, nanira ng gamit and all, like nagwild ako and after ko mabuhos yung galit ko, mafe-feel ko ang guilty and hiya. And then may pagsisisi na bakit ko yun nagawa, bakit ang OA ng reaction ko. Next is yung kleptomania. This is when a person can't stop themselves from stealing things even if they don't need or want them. This involves repeated urges to steal items na hindi naman kailangan and walang monetary reason. Meaning, hindi sila nagnanakaw dahil gusto nilang pera or yung stuff na yun, kundi dahil sa tension relief or excitement na nafe-feel nila kapag nagnanakaw sila. Dito naman is bago sila magnakaw is nakaka-feel sila ng matinding urge or sobrang kaba tapos pag nakuha nila yung item is nagkakaroon sila ng temporary relief and pleasure. Pero after that, kadalasan is nakokonsensya rin sila. So, again, nagnanakaw sila dahil sa impulse and hindi dahil sa necessity. Lastly is yung pyromania. Dito naman is may involvement na apoy wherein yung isang tao is sadyang nagsisindi ng apoy sa iba't ibang pagkakataon. Hindi dahil sa galit sila, hindi dahil sa revenge or pera, kundi sa emotional thrill or satisfaction na nakukuha nila dito. So, bago sila magsindi ng apoy, nakaka-feel muna sila ng tension or arousal and pagkatapos, relief or pleasure like nung kleptomania and yung IED. It's important to know din na yung pag-set nila ng fire dito is hindi dahil sa crime or yung sa financial motive nila, kundi purely dahil sa uncontrollable urge. This disorder is considered dangerous kasi pwedeng makasakit or makapinsala sa iba nang hindi sinasadya. According sa mga research, yung impulse control disorder is dulot daw yun ng halong biological and psychological factors. Sa biological is like yung abnormalities sa brain chemicals, na kapag may imbalance dito is nagiging mahirap sa tao na kontrolin yung biglang urge or aggression nila. Sa psychological side naman is possible causes include yung childhood trauma, yung poor emotional coping, and lack of problem-solving skills. Yung mga possible treatments din ito is same as kleptomania like CBT. Kasi CBT talaga yung pinaka-effective na approach dito. So, tinuturuan nila yung pasyente na kilalanin yung mga triggers na nagtutulak sa kanila gumawa ng mga impulsive actions nila. And natututunan nila gumawa ng strategies para pigilan to. So, to conclude my report, all these disorders, whether it's substance-related, gambling, or impulse control, share one important thing in common. They all involve loss of control over behavior and difficulty managing urges to impulses that eventually lead to serious consequences. That is why treatment should always be holistic, meaning it targets the biological, psychological, and social aspects of a person. Medication can help lessen cravings or control mood, while therapies like cognitive behavioral therapy and support groups teach people how to handle triggers, manage emotions, and build healthier habits. At the same time, prevention and awareness programs are just as important because it's always better to stop the problem before it starts. In the end, recovery doesn't happen overnight, but with the right treatment, strong support system, and personal willingness to change, people can overcome addiction and regain control of their lives.